Assalamualaikum and hi everyone. My name is Atifa Damira and my friend is Shofia Auni. Cardiopulmonary resuscitation, or also known as CPR. Are you familiar with CPR? If one of your friends just fell to the ground and you find out he or she is not breathing, would you panic, freeze, scream for help, or would you perform CPR? One day, I sat on the bench at the bus stop after class waiting for the bus. Suddenly, my friend beside me fell off and lost consciousness. I was so panicked and did not have any idea what to do. I immediately called the ambulance and thank God the ambulance came at the right time. The doctor told me if I were late and did not perform CPR earlier, maybe I would lose my friend that day. Today, the topic of our presentation is the importance of learning CPR. We will focus on two main ideas, which CPR helps to increase chances of survival and CPR is easy to learn. The information that we want to share with all of you is based on our credibility since you are the medical student at UPM. Without further ado, let's get started talking about the first point. The first main point is performing CPR can help to increase chances of survival. CPR is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest. How can CPR help someone's life? First, brain death does not wait. Cardiac arrest is a sudden loss of blood flow resulting from the failure of the heart to pump effectively. In most cases, brain death starts occurring in as little as 4 minutes after the heart stops functioning. CPR must be done as soon after the patient collapses until the ambulance arrives. When you begin CPR right away, you can help the patient minimize the risk of brain damage and death. Chances of survival double if CPR given within the first 2 minutes of cardiac arrest. According to the national statistic, less than 30% of people who experience cardiac arrest outside of a hospital receive bystander CPR. This happens because the CPR awareness is low, which results in people not doing anything at all. As a result, learning CPR is very important as cardiac arrest is a serious health issue. Secondly, we we can save someone we love. Did you know that more than 80% of cardiac arrests occur while the patient is at home? This means that we are more likely to use CPR skills to help our parents, siblings, relatives, rather than strangers. You don't have to feel helpless when it comes to your response in an emergency situation. We cannot control everything that happens to our loved one, but we can do everything possible to be ready to help in case an emergency occurs. Learning CPR should be essential for everyone. There's nothing academic about it, and you will definitely have fun while learning this life-saving procedure. Thus, CPR skill really help us during emergencies. That's all for my part. Thank you for lending your ears. I'll pass this presentation to the next presenter, Shofia Auni.
Okay. So next one. Okay. So Damira already explained the first point and mentioned how CPR can increase chances of survival. Now I will continue with the second point, why society must know and learn CPR. For your information, CPR is actually pretty easy to learn and remember. It is just physical work to pump on the chest, but the hardest part is remaining calm in face of an emergency. The basic CPR only includes 7 steps for us to learn. So next slide. Why did I say CPR is easy to learn? CPR is not a technical medical procedure and you don't have to be a doctor to perform it. However, we can learn CPR by attending the CPR class. Moreover, CPR is the shortest and most basic of all medical training classes. There are many CPR training programs available at nearly all hospitals, ambulance service, fire department, and community health center. Furthermore, I do believe many local universities in Malaysia also provide the CPR training program. See, we can attend the class easily. Next, the simplest form of CPR can be learned in less than several hours and usually the class will be divided. For adult CPR classes, it only covers the basic technique for adult, teen and adolescent. This level is perfect for the workplace or home, particularly if you are caring for an elderly person at risk cardiac arrest. To be added, training for automated external defibrillator is also taught in this course. Hence, we can know the proper way to use AED. While for the pediatric CPR classes, the CPR technique are far different than that used for the adults and may include proper airway clearance and specific chest compression ratio for infant, toddler, and young children. After class and basic training, we will be provided with a certificate that allows us to perform the CPR in public later. Second, one of the main reasons why people think CPR is hard and not administer CPR is the hesitancy to perform mouth to mouth. Of course, giving mouth to mouth to a stranger might be too much for some people. Some are concerned with the health risk involved in mouth to mouth. The good news to everyone is mouth to mouth resuscitation is not necessary for people who don't feel comfortable doing it. Back in 2010, the guideline for CPR will change with revised guideline saying that people will have no formal training or those who do not feel comfortable should attempt hands-only CPR. Hands-only CPR has been shown to be just effective for many adult patients of cardiac arrest. Hence, we have no excuse to not learn CPR. So in conclusion, as a responsible society, let us together learn this basic CPR for a better and great community. Many big reasons why we must learn CPR as we have discussed today. By learning CPR, we can increase the chances of the survival, and CPR is easy to learn, so no excuse for us. At the end, I want to highlight the quote from the Bobby Sherman. Take some time to learn first aid and CPR. It saves life and it works. That's bring me to the end of my presentation. Thank you for listening. It was a pleasure today. Well, that is from me and Namira. Thank you.
Thank you.